Welcome to another Health Writing Wednesday, where we will be discussing the benefits of finding your voice in writing. First of all, what does that even mean? And secondly, what are situations in which having found your voice can be beneficial? Spoiler alert, there is a little bit of a conversation about why finding your voice could not be as beneficial that we'll touch on as well. So I hope you're excited for today's conversation. If we haven't had the chance to meet before, I'm Megan. I'm a public health, excuse me, who am I? I'm a public health pharmacist turned health communications and health content strategist. I run a program called Health Professionals to Health Writers, which helps pharmacists and other healthcare providers learn how to replace a portion of their income through freelance health content writing. And I am excited to be here with you on this Health Writing Wednesday, where we're going to talk about finding your voice. So, when people say finding their voice in the context of writing, what does that actually mean? Well, it's pretty simple if you think about the fact that all of us have a unique voice that we use every day as we talk and we speak to other people. A voice in writing can be referred to as someone's overall personality. Like, what is the personality that is conveyed through a person's style of communication? So, I have a specific voice when I communicate with other people, like I'm communicating with you right now. You probably have a different voice when you communicate. Maybe your voice is enthusiastic and bubbly. Maybe your voice is moody and melancholy. Maybe your voice is sarcastic, right? So all of us have a different voice. The same is true of writing. Now, your voice that you communicate with verbally may be different than your preferred writing voice. It may be similar as your preferred writing voice. But I just wanted to kind of use your speaking voice as an analogy so that you can better understand what it means when someone talks about finding your writing voice. Now, how you go about finding your writing voice depends on a couple of different factors. And we're talking about this in the context of medical and health writing, as always. So, within the context of medical and health writing, how you actually find your writing voice depends on a few different factors. First, it depends on the type of medical and health writing we are talking about. So, as I always say, medical writing is an umbrella term. There are lots of individual specific types of medical and health writing that fall underneath that umbrella. And depending on which of those types you are operating in, that will influence the voice that you are going to write in. If I am a medical writer who focuses on scientific publications or, technical training materials, the voice that I'm writing in might be highly technical. It might be highly academic, highly scientific. Whereas if I am a health content writer, as I am, then I am going to be more free to use a voice that is more conversational, more friendly, more down to earth, more relatable to the general public. So it really depends on what type of health content writing, what type of medical or health writing we're talking about. The second factor that influences how you're going to go about finding your writing voice is your own individual writing experience and background. Reps in practice are incredibly important when it comes to finding your writing voice. So for someone who has a lot of experience with writing, and or maybe an extensive writing background, they might have an easier time finding their actual writing voice because they write more often. Where someone like many healthcare providers, pharmacists, nurses, etc., who has not had as many opportunities to write, has maybe not written recently. Perhaps the type of writing you've done recently has been more on the scientific and technical side. And so a personality-based writing voice is not something that you've had a lot of practice with. For that type of person, I feel confident saying that it will be a more extensive process to find your writing voice, simply because you have not had the amount of practice that it takes to find your voice. That doesn't mean that it's impossible to do it. It just means that you're going to have to spend more time practicing and figuring out what voice suits you best. So let's talk a little bit about why you might want to prioritize finding your writing voice. If you are someone who is interested in medical writing, and particularly in health content writing or other types of writing that are patient and consumer focused. And then I'm also going to tell you about a few caveats to where having a writing voice might not be as beneficial. So first and foremost, what are the benefits of having a firm and clear writing voice? First of all, when you have a writing voice, it just demonstrates skill. It just shows that you are someone who writes regularly, who has had lots of opportunities to practice, who is skilled in writing style and structure and grammar and incorporating and infusing personality into your writing. You just come off as a skilled writer when you have a very firm and clear writing voice. One of the other benefits is that it keeps you from sounding like a textbook. Now, again, in the context of publications, manuscripts, actual textbooks, right? Very scientific or technical forms of medical writing, maybe you want to sound like a textbook. Maybe that academic style is actually what you're going for. Remember that we're talking about the benefits of having a writing voice when it comes to patient and consumer facing medical writing. You don't really want to sound like a textbook on this side of things, because the audience who is reading what you're writing needs to be able to engage with it. They need to care. They need to be interested in what you have to say. And the way that you say what you're saying influences their level of interest. It influences their engagement, and therefore influences whether or not they are going to take action on what you are sharing with them. So it's very important not to sound like a textbook, because you want to make sure that you're hooking the reader, that you're engaging them, that you're even entertaining them, and giving them a reason to continue to learn the information that you're trying to share. I will say the last benefit that I'll cover of having a writing voice, of finding your writing voice, is that not only does it keep you from sounding like a textbook, but it also helps to differentiate you from other writers and from technologies such as generative AI tools. Obviously, right, from a technology perspective, obviously there are now tools that allow people to very quickly create content. Now, the accuracy of that content oftentimes is not there, especially when we're talking about medical and health related topics. We know that generative AI tools like ChatGPT, for example, are still currently lacking when it comes to accuracy of health and medical information. But accuracy aside, if you go to ChatGPT and you ask it to write a blog post about a particular topic, it's going to write a blog post about that particular topic. You want to make sure that as a freelance health content writer or a health content writer or any type of person who's communicating health information to a patient or consumer audience, that you have a voice that does not sound like ChatGPT, right? Because if your voice sounds like ChatGPT's, then what is the purpose of you being the writer? A company can simply head to this generative AI tool and create a blog post that can be fact checked and then shipped out. So you really want your voice to differentiate you from other technologies and from other writers, because if you're considering this from a business perspective, not all health content writers are freelancers or business owners, but the health content writers that I work with do so on a freelance basis. And when you're a freelancer, you are basically running a business. And so you have to think about how you are differentiating the product that you provide or the service that you provide from the service that someone else can provide. If you have the same writing voice as every other health content writer out there, then that point of differentiation is really difficult to find. And it might be more challenging for you to set yourself apart from other writers in a specific way. So this is another reason why having your own individual, unique writing voice might benefit you. It might mean that certain opportunities might not be right for you because maybe that writing voice isn't well aligned with that opportunity. But for those opportunities that are well aligned with your writing voice, you'll be well positioned to assume those. So, how do you find your writing voice? Practice, practice, practice. Reps, reps, reps. You have to write. There's no way around that. You can read all you want about voices and styles and tone, which is like the attitude to your voice, right? If your voice is the personality, then your tone is your attitude. So voice, personality, this is like overall your disposition. Tone, attitude, that is in this specific moment, what is your attitude about this thing? And so you can have a writing voice, but your writing voice can take different tones. Sorry, that was like a brief educational moment. But you can practice writing in different tones and different styles and different voices and figure out what works best for you. You also want to, of course, like heed rules of grammar if that's appropriate for your voice, and rules of storytelling structure, all that good stuff. But the bottom line is that in order to find your writing voice, you have to practice. You have to get in those reps. Now, the caveat I've been talking about, situations where it's not that you don't need to have a writing voice, but it's that in certain situations, your own individual writing voice might not be as much of a factor. If in these situations that I referenced earlier, where you are freelancing and you're working with different clients, there are certain clients and brands whose brands have their own voice. So a brand voice is the voice of the brand. It's the voice and the personality of that particular product, service, company, etc. And so for companies who have a strong brand voice, it means that the communications they put out usually also have that brand voice as well. And so if your individual writing voice is different from the brand's voice, your individual writing voice is not as relevant here, because whatever you're going to be writing is going to be adapted to fit within that brand's voice. And so you want to realize that in some types of health communications, again, especially your consumer and patient facing communications, but sometimes, if it's like a B2B company that sells a product or service to another business, they still sometimes have a brand voice. The point is, in some cases, you are not going to be writing in your voice. You're going to be writing in a company's brand voice. Again, still helpful to have your writing voice, because, there are certain situations where you would write in your voice. But my point is that in some situations, you will be taking on or putting on the brand's voice in order to create materials for them. So another area of practice for you could be not only in practicing writing so that you can find your own voice, but once you get comfortable with your once you get comfortable writing in your own voice, start to practice taking on different voices, adapting your writing voice into different styles and different tones. And that will help you get accustomed to stepping out of your voice so that you can put on a company's or a brand's voice. Again, there is no escaping the practice element of this. So you have to practice a lot. But these are ways to make sure that you're positioning yourself as a qualified writer, as a skilled writer, so that whether you are writing in your own writing voice or you are tasked with writing in a company's brand voice, you are able to do so seamlessly. My last suggestion for folks who are beginners is to avoid relying heavily on generative AI tools like ChatGPT when you are early on in your practice experience. To avoid relying heavily on those tools for writing itself. Now, if you are, trying to get ideas of what to write about, or, you know, different questions that you can answer through writing, that's totally fine. The tools are great to prompt ideas and that type of thing. What I'm saying though is like, if you are practicing writing finding your writing voice, I would suggest that you avoid relying on those tools to actually draft things for you, because the whole point of finding your own writing voice is for you to practice, and for you to get the reps in doing the writing. And if you're becoming too reliant on ChatGPT and other generative AI tools to do that for you, you're going to stunt your growth as a writer, because you're not going to be accustomed to practicing that writing voice on your own. So use the tools for prompts and brainstorming and all those types of great things. But when it comes to the actual writing, don't take away the opportunity to really grow as a writer by relying on those tools to do it for you. So hopefully this is some helpful information about finding your writing voice. If you have any questions, feel free to drop them in the comments and I will be happy to respond. Again, if you are ever interested in learning more about health content writing, you can visit the Health Writing for Health Professionals YouTube channel, which is where all of these Health Writing Wednesday videos live. And if you are interested in learning more about the Health Professionals to Health Writers Accelerator, you can always comment waitlist. That will let me know that you want to receive more information about the accelerator. And I will see y'all on the next Health Writing Wednesday.